Hi and welcome in my channel. Today I gonna talk about one of the most recent antidepressant, the only one recommended in people who haven't improved on two other antidepressant. What is it? What is chemical characters, uses, side effect, how to minimize side effect, is major drug interactions, and I gonna answer the most frequent asking questions. So let's go. Our antidepressant today is called Brintellex. Brintellex contains active ingredient called 4-tioxetine. It comes in two concentration, 10 milligram and 20 milligram. It comes all in film coated tablets. What means by film coated tablet? Not affect stomach, not harmful for stomach, could be used before or after meals, no problem. Okay, to have the time in which you have to take the second dose is 24 hours. You have to take it once per day. Metabolism, it is metabolized by cytochrome P450 by liver, mainly by liver. So you have, if you wanted to take it as for a long time or as a chronic medication, you have to make protection for liver, especially liver enzymes, and we're gonna talk how to do this inshallah in this video. Excretion, 59% is excreted through urine and 26% through feces. Okay, the second part, alternatives. Here in Egypt there is only one alternatives. I mean by alternative here is the medication which contains the same active ingredient but from another local company. Okay, it is called Fortikrel. It comes in 4 concentrations: 5 milligram, 10 milligrams, 15 milligrams, and 20 milligram. Okay, in Saudi market there is no other alternative contains the same active ingredient. Okay, what about mechanism of action? Really, it acts on a unique mechanism. It acts by a unique mechanism called serotonin modulator and stimulator. What I mean by modulator and stimulator, it blocks some receptors, serotonin receptors, and stimulate others. And it is the only antidepressant which acting by this mechanism. Okay, so it is really amazing, really has amazing result. Okay, especially for resistant depression, people who are suffering from resistant depression. What about uses? It is approved right now by FDA for major depressive disorder, but it is used officially for anxiety also. Okay, what about side effects? Mainly GIT side effect: nausea, vomiting, diarrhea, and constipation. Mainly GIT. Okay, there is another side effect which is really horrible for some persons. It is sexual side effects. It increase time for ejaculation, and decrease libido, decrease desire. The major drug interactions. Really, there are a lot of drug interactions for tioxetine, but the majors are 3. With non-steroidal anti-inflammatory medications, especially ibuprofen, with medications which acting as antiplatelets like clopidogrel by brand name Plavix, with blood thinners like warfarin and aspirin. Okay, we have to avoid using Trintellex with these medications. Okay, how to minimize side effect? we are already talking that there are GIT side effects, all GIT side effects we can minimize them by using daily apple cider vinegar before meals, and dilute it 1 spoon from apple cider vinegar and dilute it with 1 cup of water and adding half lemon juice, fresh lemon juice. Okay. If it is acute, we have to take some OTC medications for diarrhea, some OTC medications for constipation, some OTC medications for vomiting and nausea. If you wanted to know more, just write it down in comments and I gonna answer you, inshallah. Sexual side effects like decreasing libido, we have to use testosterone boosters, natural testosterone boosters. The only available here in Egyptian market is Coffeegen. The only available in Saudi market is Trintellex. There are a lot of testosterone boosters available online, on Amazon, on eBay, on iHerb and others, but I mean by approved, available in the pharmacy as food supplement. Okay. Let's go to the last part in this video, is the most frequent asking questions. Question number 1, is it effective for anxiety? Really, it is approved for major depressive disorder, not for anxiety, but it has amazing result for people who are suffering from depression and anxiety in the same time. Okay. Is it selective serotonin reuptake inhibitor medication? It is not selective serotonin reuptake inhibitors. It acts by mechanism called serotonin modulator and stimulator. It activates some serotonin receptors and block others. Okay, you get it? So the mechanism, to be more specific, serotonin modulator and stimulator. Okay, but in general, both of them increase serotonin levels in the brain. Okay, you get it? Who should not take it? Persons who should not take fluoxetine or Brintellex or Trintellex are who already taken medications for platelets or for blood thinners, as we are talking we already talking about it, clopidogrel or warfarin or acetyl salicylic acid. I have resistant depression even with fluoxetine. What is the solution? In my point of view, in cases who are resistant even for fluoxetine or Brintellex or Trintellex, the only solution in this case is electroconvulsive therapy. I'm gonna make complete comprehensive video about electroconvulsive therapy here in the channel, inshallah. What about using fluoxetine or Brintellex for bipolar disorder? Really, it is approved as depression medication, okay? But some psychiatrists write it down with antipsychotics for treating bipolar disorder. Okay? Is it safe with antipsychotic? Yeah, it is completely safe with antipsychotics. The main difference, question number 7, the main difference between acute and major depressive disorder. The main difference is that major depressive disorder is usually accompanied by suicidal thoughts, suicidal attacks. Okay, that's it. How can I use it? Before or after meals? You can use it before meals or after meals because it comes in film-coated tablets. Not affect stomach, not harmful to stomach. Okay, that's it for today. If you have any question, just write it down in comments. I'm gonna answer you during 24 hours, inshallah, maximum. Bye bye for now.